Good afternoon, everyone. Thank you all for joining Bakersfield Behavioral Healthcare Hospital for this educational webinar on the truth about depression and suicide in older adults. We applaud you all for taking the time to learn about this topic, whether it's for yourself or someone you care for. We think it speaks volumes that you're willing to learn about this important topic. My name is Alicia Sanchez, and I am a community liaison here at Bakersfield Behavioral Healthcare Hospital. We hope you'll enjoy this event. Please stay tuned as we will be sharing a link to a survey at the end of the webinar to get your feedback on this event and answer any questions you may have, or contact you should you want any mental health services for yourself or a loved one. Without further ado, we have Bakersfield Behavioral Healthcare Hospital's very own CEO, Maureen Womack. She holds a master's in psychology along with extensive experience in the mental health field. She will be our speaker today. Thank you.
Hello, everyone. Thank you for joining me today. I want to talk to you about something we all know too well, but nobody seems to want to admit, and that is getting older. Today, we're going to dive into a topic that is as heavy as your grandma's fruitcake, but just as important: depression. However, before we start, let's clarify a few things. First of all, when does old age begin? Personally, I'm beginning to think it's when your back goes out more than you do. I've also heard it said that older age now starts at 75. But again, that seems fairly arbitrary. If you ask a 90-year-old, they'll tell you 75 is practically adolescence. So really, we're all just getting here. But for the sake of today, let's just say if you remember using a rotary phone, then you're in the right place. Let's talk about our perception of older adults. One of the most important messages that I hope everyone hears today is that being older is often defined by negative images of older people. We call this ageism. From anti-aging face creams to wisecracking birthday cards about getting older, or the okay boomer memes, the message is clear. Being old is something to avoid. Never mind that if we have the good fortune to live a long life, our inaccurate stereotypes about aging will still cause us harm. Around 1970, Bob Dylan composed a song called Forever Young. In writing this song, Dylan underscores a central tenet of the American culture. America is a country for those who are independent, active, and positive. These features require youthful energy and enthusiasm. In other words, a cultural imperative of staying forever young. Becca Lee is a psychologist from Harvard. She and her research group found that age stereotypes can influence everything from memory to balance and the willingness of individuals to follow healthy lifestyles, including at times following the medication that has been prescribed. In one study, Levy and colleagues found that individuals are more positive perceptions of aging lived 7.6 years longer, almost 8 years longer than those who took a negative view of aging. The adverse effects of negative age stereotypes points to the need to develop interventions that will maximize the influence of older individuals' positive age stereotypes in their everyday life. Officials in Japan, for example, have called for the country to take steps towards becoming an age-free society. Instead of where you're expected to retire at a particular age, people are encouraged to remain active and work for as long as they are willing and able. So the message I want you to hear today, before we dive into depression, is that you get to define how old you are. Just for 1 minute, I want everyone to close your eyes. Now, if you didn't know how old you were, how old would you say you are? For many of us, it's probably 10 to 20 years younger than our chronological age. But regardless of how old age begins or when it starts, we know that its fair share of challenges come along with aging. This includes depression. Here's the thing. Depression can feel like an uninvited guest at the party of life. It shows up without warning. It eats all of your snacks, and then it refuses to leave. So today, we are going to explore one of the least funny but most important topics we face as we age, and that is depression. Depression in older adults is a very complex condition, and it often goes unrecognized and untreated. Depression can affect individuals of all ages. Older adults face these unique challenges where depression will mask itself, oftentimes presenting as a physical health condition. I'm going to touch today on other factors that may influence depression. These include the influence of the pandemic, social isolation, substance use, ageism, medical bias, and chronic disease and pain. Let's start with just a basic understanding of depression in later life. Depression in older adults is very different than the way depression manifests itself in younger populations. While it can, on occasion, manifest itself as persistent sadness, irritability, or loss of interest in activities, many adults may not recognize these symptoms as depression. Instead, depression may be dismissed as just a normal part of aging. This is what contributes to the underdiagnosis and undertreatment of the condition. Depression in later life is a hidden epidemic. It's underdiscussed, and as we mentioned, undertreated and diagnosed. We often attribute the signs of depression to things like low energy, a loss of interest, changes in sleep patterns, or memory issues, and these are considered to be part of the normal aging process. But this is not the aging process. In reality, this is a silent scream for help. Older adults face unique challenges like chronic disease, chronic bereavement, financial insecurity, and the cumulative impact of social isolation. These are not mere life adjustments. They are profound losses that can shape our mental well-being. Late life depression, or LLD as it is called, can be distinguished according to the age which the first depression occurred. If there is no history of depression earlier on before the person is in their 60s or 70s, we call this late life depression. Late life depression is characterized by an atypical cluster of symptoms. These usually present themselves as somatic complaints, such as, aches, pains, fatigue. Not so much the mood symptoms we think of with depression. We usually think of depression as feelings of sadness, of feeling unworthy, but this is not the presentation in late life depression. Depression can be precipitated and perpetuated by chronic medical conditions. The diagnosis of depression is extremely challenging in older adults because it often presents as a medical organic disease. Feelings of dysphoria or sadness are frequently absent in older adults, indicating, and this is why we call it often you'll hear, depression without sadness. It is characterized by a lack of interest, sleep disorders, lack of hope, loss of appetite, and unfortunately, thoughts of death. In fact, loss of interest is usually pronounced since older adults tend to be more stoic, they're less likely to complain, they're less likely to want to bother someone. So suicidal thoughts become more frequent in late life depression, particularly If you have a state of anxiety, especially in the morning, this is another marker of late life depression. We also look for loss of appetite and weight loss. Fatigue is often expressed as both physical tiring and a lack of energy rather than a mental symptom. Sometimes in earlier adulthood, the sense of fatigue is more like a mental fatigue, a feeling of heaviness or just a difficulty in thinking. But it feels more like a physical fatigue in older adults. In older people, we manifest more vague gastrointestinal complaints, together with excessive worrying about one's health. You know, any kind of ache and pain may make us think that we're either having a heart condition or could this possibly be a cancer. These kind of concerns and anxiety about our physical health is an indicator that the individual may be suffering from some form of depression. Much like cancer, there are different types of depression. These are called geriatric depression syndromes. Yes, we have our very own special depression syndromes. The first one is vascular depression. Instead of being characterized by psychomotor slowing or lack of activity and a lack of initiative and apathy, it is typically observed in patients with a medical history of hypertension and cognitive impairment. So again, we'll see the psychomotor slowing, lack of initiative, and apathy. Then there's what's called the depletion syndrome. When I first heard this, I thought, oh, this is when your kids come back to live with you. But no, that is not what we mean by depletion syndrome when we talk about depression in older adults. The depletion syndrome is characterized by lack of interest, sleep difficulties, lack of hope, loss of appetite, and most importantly, thoughts of death. The depletion syndrome is called depression without sadness. A third type of depression is also called reversible dementia. In many cases, older adults suffering from severe depression may have marked cognitive impairment. And so this often leads clinicians to diagnose the condition of dementia. However, if properly diagnosed, cognitive symptomatology or problems with memory, short-term memory, recedes with the remission of the depression if the depression is treated. Next, I'd like for us to take a minute and look at just a few of the risk factors that are associated with late life depression. The first one is being female. We know that females have a higher prevalence of depression than males. There are also some physical related factors that often accompany depression in late life depression. These are things like heart disorder, digestive disorders, respiratory disorders, urinary incontinence, definitely sleep disorders, impairment of hearing, abdominal obesity, metabolic syndromes, and kidney disease. There are some psychological factors that are also risk factors for developing depression. One of the psychological factors we look for is excessive anxiety or worrying about things that are beyond our control, often having a sense of dread or that feeling that you're just waiting for the other shoe to drop. This is a key marker in the diagnosis of depression. There are the social related factors, such as the psychological stress in daily living. As we grow older, sometimes we have loss of social and a supportive network. We may feel more isolated. We may feel that we're receiving less emotional support from our family members. And sadly, there may be the loss of a spouse. And then finally, we have the cognitive impairment. But here's the good news. There are also protective factors. Having a high level of self-esteem, being resilient. By the time we get into our late 60s and 70s, we've been through a lot in life and we have managed to bounce back. This is an important factor in warding off depression. Being extroverted, and by that I mean staying in touch with friends or participating in activities. Being able to kind of control your emotions, what we call emotional regulation. Having a self perception of aging that's positive, seeing that aging is just part of a continuum of our life and that there's a life purpose in the stages of late life as much as there is in our mid adulthood. Also, having a high sense of control, feeling like that you were in control of your health, you were in control of your life, and having adopted healthy coping strategies. We also know that if you have hobbies, if you have strong faith or spiritual beliefs, and you remain physically active, these are also things that protect you from becoming more susceptible to developing a depressive syndrome. If we keep ourselves mentally stimulated, things like reading, doing puzzles, word games, cards, board games, all of these things, anything that will keep you mentally active, is also something that helps us in terms of warding off or preventing depression. I'm going to take a few minutes and we're going to revisit the pandemic. I know that none of us do, but it has really made an important negative influence on older adults. The pandemic created a perfect storm of risk factors for mental health deterioration. We went through lockdowns and quarantine measures. These were meant to protect the vulnerable populations, such as older adults. However, it also increased social isolation. And the other thing it did is it limited access to healthcare services. Research has shown us that feelings of loneliness surged during the pandemic. We had prolonged isolation, which really increased the risk of depression and anxiety in older adults. In addition, the pandemic induced stress and fear. There was the fear of contracting the virus. We didn't know much about the virus. We didn't know how severe the pandemic might be, or if you contacted a virus, what it might do to your health. There was also the loss of our loved ones, which further fueled depression. Many adults also struggled with technology. For some of us, we may be able to do Zoom calls or face or live chats, but some people did not have either the technology or the access to technology to be able to digitally stay in contact with our friends and loved ones. The other stress factor that occurred as a result of the depression was an economic impact. The percentage of older adults in the United States that reported using up all of their savings, or they lost their job just before retirement age, or they lost another source of income because of the pandemic, was 4 to 6 times more than those for individuals, say, in Germany, Switzerland, the Netherlands, Norway, or even Sweden. Along with the social isolation, I think it's worth kind of drilling down a little bit on that. We as human beings are social by nature, and high quality social relationships are vital for health and well being. Freud said the 2 pillars of life are love and work. He said these 2 primary indicators are necessary for a person's mental health. He argued that love provides personal fulfillment through love, relationships, and emotional connectedness, while purpose offers structure, social contribution, a feeling that we're making the world a better place as a result of our efforts. Both of these are necessary for a psychologically healthy life. Like many other social determinants of health, however, loneliness is a subjective feeling, and yet it is really unappreciated in public health risks. Social isolation and loneliness are associated with poor physical and mental health outcomes, including higher rates of mortality, depression, and cognitive decline. Recent research documents the effect that social isolation can have on our physical well-being. Approximately 1/4 of 24% of community-dwelling Americans aged 65 and older are considered to be socially isolated. A significant proportion of adults report feeling lonely. 35% of adults aged 45 and older, 43% of adults 60 and older report feeling lonely or socially isolated. Social isolation has been associated with a 29% increase in the overall cause risk for mortality and a 25% increase for cancer. Loneliness has been associated with higher risks of anxiety and suicidal ideation. Within this lonely group, 53% have reported levels of depression above the threshold that is significantly clinical for a diagnosis of depression. Loneliness has been associated with a 59% increase of risk of functional decline and 45% increased risk of death. I'm going to repeat this. Loneliness has been associated with a 45% increase in death. Poor social relationships have associated with 29% increased risk of coronary disease and heart failure. 68% of individuals hospitalized report feeling isolated or lonely. Social isolation is one of the most significant contributions to older adults. The Surgeon General, Vivek Murthy, called loneliness and isolation one of a major public health care epidemics. Research also indicates that those who feel isolated are much more likely to feel isolated, which leads to what we consider to be a full diagnosable depression. Sadly, many of us have remained locked down since the pandemic. We've not ventured out. We've not gone out and tried to normalize the way we behaved prior to the pandemic. We have found that we don't really need to go out. We can have everything delivered. We can have food delivered. We can have booze delivered. We can even have our toilet paper delivered. So most of us find that there's not as much need to go out. And this has resulted in many people remaining to be isolated or in self-imposed lockdown. Substance use disorders among older adults is particularly complex, and it may not go recognized. There is a challenge by healthcare professionals in diagnosing substance use disorders. There may be a false assumption that older adults don't use or misuse substances, or that this is normal. But it is not normal, and there is a high rate of substance use disorders in older adults. Older adults may use substances for different reasons than younger adults do. They may use substances to help manage chronic pain. Substances may be used to help mitigate or lessen the pain of loneliness, depression, anxiety, grief, or stress. They may also have different patterns of use, such as binge drinking. Oftentimes, we'll see prescription drug misuse or polypharmacy, using multiple medications or supplements. The reason that these are often diagnosed is the presentation of substance abuse may look at some of the factors that some people attribute to aging, such as a slurred speech, or somebody falls. They think, well, it's normal to fall when you get older. It's normal to slur your speech when you get older. But this is also signs that we really have to look at. Is there an issue with substance abuse? The vulnerability cannot be understated. People in their later life do not metabolize alcohol and drugs as well or as quickly as younger people. We're more likely to experience chronic health problems. We tend to be prescribed more medications, and many of these medications can be addictive. Our social and emotional challenges may arise from disability or loss of loved ones. So, in recognizing the signs of substance abuse, the things we need to watch for are falls or other injuries. If you see somebody who's bruised, poor hygiene, the inability to perform self-care tasks, somebody reporting dizziness, headaches, unexplained weight loss, blackouts, or even chronic pain should be a clue that we need to be asking about the substance use. In recent years, the number of senior citizens seeking addiction treatment in the United States has skyrocketed. The number of adults 55 and older who sought out addiction treatment increased more than 50% from 2009 to 2020. This alarming statistic shows that substance use disorders do not discriminate and can affect any population, including older adults. Alcohol is the drug of choice for many older adults. About 65% of people 65 and older report high-risk drinking. 65% of us admit to high-risk drinking. We consider this to be anytime somebody drinks 5 or more drinks on the same occasion, that's binge drinking. 4 or 5 drinks a week, that's considered to be high-risk drinking. Besides alcohol, we also see people who are in retirement age or older starting to use cannabis. We're baby boomers. We started the weed. We started using marijuana. And marijuana has become, in some minds, medicinal. But the problem with the marijuana today is that it has much higher rates of THC, and it is much higher to metabolize the brownies that some people may have eaten when they were younger. We also find that, unfortunately, a number of older adults are prescribed benzodiazepines, such as Valium and anxiety and Xanax or Ativan. They may go in and tell their physician that they're feeling anxious, and so they prescribe Valium or Ativan. But these are highly addictive medications, and so again, they should not be considered first line for any indication in an older adult. So please, if you're taking Xanax or Valium or benzodiazepine, talk to your physician about the safety of that medication. And then finally, there's opioids. And we have heard a lot recently about the opioid crisis. But as we get older, the reality is we have more chronic pain. And this has resulted in increased prescriptions, which are highly addictive and have serious side effects. You'll hear people being prescribed Percocet or Oxycodone, Vicodin, codeine, morphine. But again, these are very serious medications that can result in death. So anytime you have any of the symptoms that we have talked about, feelings of loneliness, feelings that you slowed down, feelings that you're apathetic or that you don't enjoy life, talk to your doctor about depression. Depression can sneak up on any of us at any time. The last thing I want to touch on, just briefly, is this concept of ageism. We have been the brunt of many jokes in the United States. Older people are on many cards. Oftentimes, older people are meant to feel like now that they're a drag on society or they're an economic burden because of the cost of medical care in later life. Anytime you hear this, though, I want you to counter it with this. Healthcare economics has estimated If we could use all of the hours of older adults put into caregiving and we put a monetary value on those hours, older adults contribute $450 billion a year to the United States economy. I think in reality, in other communities, more rural, it would be between 200 and 300 billion. But again, that is a significant contribution that we should not overlook in terms of what we provide by taking care of our grandchildren, by doing volunteer work, by doing things to help our community. And finally, medical bias. Oftentimes, you'll hear that physicians tend to think of some of the complaints or somatic complaints that older adults present with as just part of the aging process. Speak up. Tell your physician that no, this isn't aging. This doesn't feel right. I really ask you to listen to me. And then last, and probably the most unspoken tragedy that we want to talk about tonight, is suicide. Let's talk about the statistics of suicide among all age groups. Older adults, especially those over 75, have the highest rates of suicide. In fact, older men, particularly those aged 85 and above, have a rate nearly 4 times the national average for other age groups. Why? Because the losses that we experience are cumulative. The coping mechanisms that we had in the past no longer suffice. We gradually withdraw from relationships. We begin to lose our sense of purpose. And so one solution that people entertain is ending our life. And yet I need people to know that suicide is preventable. And all it takes is awareness and compassion. George Eastman wrote a note to his friends, and it said, "To my friends, my work is done. Why wait?" George Eastman committed suicide. He still had many years and many contributions that he could have made, and yet he chose to end his life. So let's change the conversation. The first step to preventing this tragedy is to change the way we think about aging and mental health. Depression in older adults is not an inevitability. It is not just a part of growing old. We must challenge ourselves to see beyond age. We have to look beyond our wrinkles, and we need to have our stories heard. We need to talk about mental health, not only in the context of youth, but in the context of aging. Older adults need to feel safe talking about their struggles without any fear of judgment or feeling like they're just going to be dismissed. So my challenge to you today is to break the silence. Today, if there's one thing I want you to leave with, it's that we can no longer afford to have our silent cries go unheard. We are not just getting older. We are human beings who are worthy of love and dignity and the opportunity to heal. If you are experiencing these feelings, know that you are not a burden, that you are valued and you are needed. Reach out. We want to listen. And to those of you who have older ones in your life, please check in with them. Ask them about their emotional landscape. Don't think of it as an intrusion. Think of it as an act of compassion. In the journey of life, aging is not a destination. It's a continuation of living. Our older adults have stories. We have dreams and we have hopes. We deserve to experience our final chapters with peace, not pain, with connection, not isolation, with meaning, not despair. Together, we can create a society where growing old doesn't mean growing alone. Let's be the generation that brings light to the shadows, hope to those who feel hopeless, and love to those who feel lost. Thank you so much for your time and giving this opportunity today to let me speak to you about something that is so important and something that deserves the attention of all of us. Depression is treatable, suicide is preventable. If you have any concerns, please, once again, I encourage you to reach out. We will be here for you. Take care.